and on the behalf of FDC and Med Talks, I again welcome you all to today's session. Today's session is very interesting. In today's time when everything is just one click away, even from watching your favorite shows or to booking a doctor's appointment. So when it comes to waiting in a clinic for consultation, sometimes it become a challenge for few patients. So when the value of visit is high or the patient really want to see a doctor and the cost of waiting is low, then patients are more willing to wait. So today's topic is about that only, that how to optimize patient waiting time towards constructive user time. So today's topic is creating an illusion of time in diabetes clinic. So today's session is brought to you by Inrizal Zero. Before moving forward, I would like to announce the last week quiz winners: Dr. Monu Gurang from Chandigarh, Dr. Sanjeev Puri from Hoshiarpur, Dr. Prabhu Desai from Mumbai, Dr. Surjit Kalsi from Noida, Dr. Apurva Vishwas from Ramgarh, and Dr. Anand Purande from Mumbai, Dr. S. Raman Tripathi from Robertsganj, and Dr. Ashwani Kumar from Kanpur, and Dr. Satish Kumar Jain from Bangalore. Okay, so now, and thank you for taking part in our quiz. Now, coming back to our topic, creating an illusion of time in diabetes clinic, I would request our host, Dr. Sanjay Kalra, President-elect, South Asian Federation of Endocrine Society, to give a light on this very interesting topic. Over to you, sir.
Thank you, Ankur, and good evening, everybody. It's a very cold and rainy day here in Karnal. The feeling is that time has come to a standstill. But then, time is the fourth dimension of life. It is something very active, very real. You cannot catch time, so that way it's not tangible. But then, sometimes time becomes a very precious commodity, and this is especially true in our clinics. We are always running short of time. And how many times have you heard people say, I don't have time? Everybody has 24 hours in a day. So it's not that you don't have time. How often have we ourselves said, I am so overworked, I don't have time? But then even our president, our prime minister, sir, they also have the same 24 hours in a day. So it's just about how to utilize time. Now, if you go to the planet Mars, they have 25 hours there in a day, it seems. So I did think of migrating once, but then, there was no aeroplane to take us there. So I decided to try my luck on planet Earth only. In today's talk, we'll be speaking about how to create an illusion of time. How can you, as a magician, as an expert, how can you spend just 3 or 5 minutes with the patient, but give the patient the feeling that you spent 30 or 50 minutes with her? How can you give the patient the feeling that you are in part and parcel of their family? You are part and parcel of their journey of life with diabetes. How can you create that feeling कि हम आपके हम सफर हैं? I am your travel companion and there with you throughout time, even though I spend just 3 or 5 minutes with you. This is challenging, no doubt, but we can do it. Certainly, we can. Diabetes is a demanding condition. Our patients have to fulfill so many challenges and demands of living with diabetes. They spend so much energy coming to us for consultation. So, if they are spending so much time, why can we not do that? Of course, we say that we are overworked and we are fatigued, but if we as doctors are not able to take care of our own fatigue, then the patients are right in saying, Doctor Saab, you are not able to take care of yourself. How will you take care of me? So we need to understand how to manage time. If we can do that, we will actually be able to overcome the suboptimal satisfaction levels that each and everyone seems to be complaining about. And I would be the first person to say that my patients do complain about me. I do get fatigued, but I would also like to say with both hands up in the air that I try my best. And even though I am growing older and I'm gaining experience in youth, actually, that is what Dr. Suneet Verma and Dr. Hitesh Punyani say to me. In spite of that, I am trying my best, and I am getting better and better with every passing day. So let's look at the principles of creating an illusion of time. If you want to expand time, you have to expand other things. So let us expand the time frame. You're taking a history. So, madam, you've had diabetes for how many years now? How did you feel when you developed diabetes? What happened at that time, 10 years ago? Fast forward, over the past 10 years, overall you've been fine. Have you been in command of your diabetes, or has diabetes been in command of you? That was past. How can I help you today? And then future. So what do you look forward to in future? What is it that you would want? Which kind of symptoms would you want resolved? Which kind of complaints or concerns are the most pressing ones for you? So expand the time frame, talk about past, present, and future. Expand the interviewing team. Teach your staff. You do not have to have qualified or educated diabetes care paramedical staff. Very few of us do. But even the interviewing team, whether it is the sweeper, whether it is the receptionist or the physician assistant, they should be part and parcel of the interviewing team. So, how are you, madam? How can I help you? The doctor will see you shortly. In the meantime, uh, why don't you revise the questions that you wish to speak to him, or why don't you check whether you brought your kidney test or your thyroid test report? So you can expand the interviewing team. If you have staff, if you have place, you can give the patients questionnaires to fill. They can fill them on their own, or maybe the staff can help them fill these questionnaires. You can give them education material to read in local language. Expand the reference as well. What do I mean by this? Your glucose is not up to the mark, but look at the good things, madam. Your blood pressure is fine. Your cholesterol is also not so bad. And see, your kidney tests, it is the kidney test that I always worry about when I see my patients. Your kidney tests are fine, which means we are good to go. So expand the reference. Now, when patient goes back, she will think my doctor spoke to me about sugar and kidney and liver and heart and cholesterol. So I've expanded the reference. It didn't take me extra time. If you are able to expand this reference in a biomedical sphere, why don't we expand the definition of health? So the definition of health, as decided, as explained by the WHO, is physical and social and emotional and mental well-being, all of them together. So let us do it now. Madam, I am prescribing this medicine for you. You will find within 2 or 3 days, your social health will come back. You'll have a smile on your face. Sir, we are giving this medicine to your wife. Now, whenever you get your morning tea, within 3 days, you will notice the difference. You will get your morning tea with a smile. And then the man laughs and he says, Arey, sir, at our home, I make the morning tea. I cook breakfast, lunch, dinner. Then you say, Arey, well done, shabash. You're a very good husband. So now, when you serve the tea, you will get a smile in return. So take it that way. So, see, we've added social health. Another way of doing this is um, we are prescribing this medicine. Within a few days, you will feel like going to the temple. You will feel like going to the mosque. And you will feel like going to the Gurdwara Sahib or church to pay obeisance. So that's social health. Then psychological health. And we talked about it last week when we spoke about happiness. Ma'am, this medicine will bring a smile on your face. I am very sure. And while you're taking the medicine, please remember to smile as well. So, psychological health. And then biophysical as well. See, the glucose will come down, the blood pressure will come down within a week or 10 days, whatever is right, whatever is appropriate for that patient. But these symptoms that you have of pain in the feet, pain in the head, in the abdomen, these will disappear in 24 to 48 hours. If you want to expand time, you speak in years. So, ma'am, this medicine is going to serve you for years to come, for decades to come. If you want to minimize, you want to make it fast, then you speak in hours. Don't say 2 days, say 24 to 48 hours, your abdominal pain will disappear. So, you're expanding the definition of health and you're using the words related to time. Hours to convey that you're going to do something very fast, maybe minutes or seconds also. Supposing somebody comes in with hypoglycemia, and then I'll tell them, why don't you sit down and maybe have a drink of Enerzel or Enerzel Zero, and within seconds it'll work. Now, of course, it will take 4 minutes, 5 minutes, but that was also just 300 seconds, isn't it? So it'll work in seconds. And this health that we are giving you, uh, let's give you an iron tablet, maybe Vitcofol. This will keep you healthy for years to come. So you use these words also, and expand the interviewee team. Now, don't look only at the patient in front of you. Look at the family that has come. See, they are also investing time and energy. Now, to be honest, I am a very introvert kind of a person, and my OPD is very small, 10 by 10. But sometimes when six or seven people come in, I do feel a bit, I don't feel afraid, but I feel uncomfortable. So, what do? I keep the back door open. I try to give a bigger kind of a feeling to my room, and I do acknowledge each and everyone who has come in. So I will say, "Thank you, young man. In such winter, in such cold season, you brought your mother. I appreciate the work you're doing for her. Together, we will make sure she remains healthy." And then we'll say, uh, "Young boy has come. Thank you, young man, for accompanying your grandfather. Would you like to be a doctor and would you like to take care of your grandfather? So we are writing these medicines. Can you please remind him twice a day to take the medicines on time? And can you become our exercise doctor? So you have to make sure that your granddad does exercises twice a day. Which exercises? Exactly the same one that you did in school in PT. You come back home and teach him, right? You teach him marching on the spot. You teach him how to bend up and down. And then see how that doctor, that 9-year-old boy, takes charge of his grandfather's health, and he does all the work. And then who gets the credit? It's you, because you prescribed the medicine and you got the HbA1c and BP down. So let's repeat what is on this slide. Creating an illusion of time. Expand the time frame of reference. Expand the interviewing and interviewee team. Expand the reference to biophysical health and also to each and every definition of health. Do remember to touch psychological, social, and mental health in each and every patient who visits you. If you address all domains of health and talk about multiple phases of life and talk about the future as well, then you are able to create an illusion of time. So maybe somebody comes and says, I am tired. I have always been tired in my life. So, madam, how were you during when you were a child, when you were in school? Sir, how were you when you got married? You must have been very handsome then, sir. How was it like in college 60 years ago before you got married? So, see, he goes back to 60 years ago. And then when he leaves your OPD, he will keep on remembering that. The doctor asked me how I was. And now I'm thinking about how I was when I was young. I am actually feeling younger. Don't say you are 80 years old. Why don't you say to the gentleman in front of you, you are 80 years young, sir. You have so much of experience of youth and vitality. Please share a few tips with me as well. That is another way of achieving an illusion of time. You can, while treating your patient, you can get them to treat you. Touch all senses of the patient. Be well groomed yourself. Whatever your patients expect from you, according to the place where you are working, according to mm, uh, social expectations, you wear the right clothes, the right colors, the right footwear. Speak in such a way that the patient wants to listen to you. Listen in such a way that the patient wants to speak with you. Touch in a friendly manner, in an empathic manner. If required, keep any perfume or any agarbatti room freshener in your OPD. That helps. And you can also use taste. So, supposing there is a medicine that is bitter, like let us say quinine or maybe some kind of steroids. So then you say it's slightly bitter, but it will have a sweet aftertaste because your health will become much better. So you talk about that. Some medicines you might want to give them a feeling. This 500 milligram tablet that we are using for diabetes, it's big, but it's a very masculine kind of a tablet. It'll fix your sugar in one go. Don't worry at all. So make these medicines a bit human. Give them a human or an animal related or a plant related kind of a feeling. Now, some of you will say we were speaking of creating an illusion of time, but what are you doing in today's discussion? So much of time you've already wasted, and you've not even talked anything about diabetes. So, this is actually the trick. When you want to complete a conversation within 3 or 5 minutes, it is more important to structure it. So, let us look at the phases of a diabetes conversation. This is how I go about it. Initiate the conversation. Good morning, sir. Good evening, madam. Namaskar. Namaskaram. How can I help you today? What are your complaints and concerns? Yes, you've talked about these biomedical issues, which might be a concern regarding fatty liver, which might be a complaint regarding dysfunctional uterine bleeding, or maybe sexual dysfunction. This is how we can help you in a non pharmacological manner. This is how you can help yourself. Any one or two do's, one or two don'ts. So please do remember to eat lots of fresh fruits and vegetables and salads. Please do not take too much of ghee or cooking oil. Please do try to add spices like cinnamon or like elaichi to your tea. Please do not go for fat diets. If we do this, the drugs that we are prescribing will also help you. So you give the drugs a secondary place, actually. Of course, you are writing the right drug, but you try to focus more on lifestyle modification first. And yes, these medicines, these biomedical things we have told you. But tell me, is all well at home? How are you doing? Everyone in the family is fine. Where have the children reached now? So you know whom to speak with about what. And if you don't know the patient, so now how do you know whether the patient has primary infertility or not? So then you just use neutral words. I hope all is well in the family. How are you doing? And then you talk about social and professional things. Whatever the patient says, you just be present in that mind at that time of mind. Let the patient drive the conversation. So if the patient says, yes, there's a smile and my children are doing this, or my spouse or my parents are doing that, that's good. Wish them all the best from me. And do thank everyone at home for having taken care of you. Supposing you see a frown or something sad and they say, oh, I understand what you're going through, but don't worry, I am also part of family now. We'll work together to overcome these obstacles. And please request such and such a person to help you out with lifestyle modification. Thank you, and I look forward to meeting you again. When you say, I look forward to meeting you again, or maybe we can call you back after 10 days or after a month, you're also expanding the reference. So you're talking about the future. But do remember, in an effective conversation, you should touch each and every domain of health, even if it's a passing conversation. So I hope all is well at home, all is well at work. Even this is enough. Now, time is at a premium, and it's that's true for all of us, even today. So let me talk about 12 hours of time enhancement. Let us look at 12 aspects. These 12 we will structure into four. So first is initiation of conversation. So 3 R's are recognition. Good day, sir. How are you doing? Now, with this, I have not even said to the patient whether I recognize him or not, because so many times it happens. I say this, good day, sir, how are you doing? And the patient says, I'm coming for the first time. So, welcome, madam. And then the patient say, yeah, I am fine. I had met you 2 years ago. These are your old prescriptions. So, recognize with a smile. Say something relevant. So now if it is winter, and then it doesn't make sense for me to say, so did you go swimming yesterday? I mean, that doesn't make sense here in North India. So something relevant. It's cold, it's foggy, anything to break the ice. And if you are able to remember, that is nice. On your notes, you might wish to write something on the sidelines, maybe son's marriage in January, something like that. So how is the son doing? I hope the marriage went off well. So try to remember these things, the social things about your patients. You've initiated the conversation. Then you move on to a medical conversation, where first we speak biomedical, then we speak psychosocial. Reconnoitering means, yeah, so how has it been over the past few months? How has it been since you visited us last? Raise new issues. Your cholesterol seems to have come down. That is great. But the serum creatinine is rising. And don't worry, we'll fix it up. See, the potassium is okay. So it's not very life threatening right now. So try to reduce the negative things. Nobody likes hearing negative things, and increase the positive things. Even in chronic kidney disease, see, you're fine. Your doctor has put you on dialysis, so you'll do very well. I am very sure, and you just follow the nephrologist advice, and the potassium is fine. Whatever issues the patient raises, complaints and concerns, reply to them, and try to close the loop. Yeah, you told me that you are worried about the pain in your shoulder. We'll prescribe insulin so that glucose comes down, so that the inflammation comes down, and then your frozen shoulder will also improve. Of course, you will have to exercise for that, and that we've already told you. Keep the style of conversation a bit witty, a bit happy. Rephrase what the patient is saying in local language. Always use some amount of humor. and be relaxed. Do not feel stressed out in the OPD. If you are relaxed from inside, you will be able to communicate relaxation and your patient will get relaxed and time will fly in a second. So actually you will end up saving time. And some pearls of wisdom to end with. Like I said, you record the important things uh, on your OPD notes. Uh, Repost time means you can always say, yeah, okay, so you've had this issue now for the past 10 years, you've been struggling with thyroid. Give us maybe 10 days at least. 10 weeks would be great, but I'm very sure we can fix it up in 10 days. This is what we are going to do. And reflection time is okay. Now you getting stuck in the OPD. Patient just doesn't want to leave. So, madam, why don't we do something? Please have this pen and paper. And you've talked about so many things, so many concerns that you have. Perhaps you could just sit for a few minutes and think about what is it that is the most pressing issue for you. In the meantime, please allow me to see this elderly lady. She's been waiting for a long time, and then I'll spend some more time with you. So that's another way of asking them for reflection time and then moving ahead with your time management. So these are some things that we had to share. uh, Last week, if you remember, we spoke about happiness in the clinic. Today we've spoken about illusion of time. And once again, I would like to thank my close friends who have helped me develop this concept. Dr. Hitesh Punyani, a physician from New Delhi, Dr. Munish Dhawan, pediatrician from Haryana, and Dr. Sunit Verma, diabetologist and obesity specialist from Panchkula in Haryana. Next week, we'll be talking about how to teach diet within 5 minutes. And that is important for many of us because uh, we don't have trained dietitians. So we have to be fast and we have to teach something to the patient that the patient can actually take back home and follow. Dr. Anand Purandare says, and very rightfully says, so that time is relative, as said by Einstein. And that is true for the OPD as well. You can make it relative. You can actually use time in such a way so that the patient feels that he or she has spent an eternity with you. And we see from Dr. Verma a comment that awesome ways of spreading happiness and saving time. And we thank Dr. Verma. He is one of the leading diabetologists in Tri City, Chandigarh, Panchkula, and Mohali. So thank you for sharing your words of wisdom, Dr. Sunit. These are topics which touch the art of diabetes management. And next week will be another such topic. We'll be talking about science and art both in terms of nutrition and in terms of diet. We'll continue after that with a new theme in diabetes management and diabetes essentials. And in March, we'll be spending 4 weeks talking about pre Ramzan education because the holy month of Ramadan will start in the end of March and we want to focus on that. We continue being with you in Diabetes Essentials and we invite all of you to join us in our journey towards health, towards happiness for our great country, towards making India the diabetes care capital of the world. With this, I'd like to welcome Team FDC back and ask for their comments.
Thank you, sir. I think now we are coming to the end of session two of Diabetes Essential with Dr. Sanjay Kalra. And even, they see the kind of sessions we have been taking are very important because at the end, sir, we all are, all doctors who are juggling with the number of patients and, the what we say justice they do with the patients, what we say tolerance limit as well as the expectations. Today's session as well as the last session is very very important for them because they have learned newer techniques to how to increase the happiness within that OPD time and illusion of the time. So with this, I thank Dr. Sanjay Kalra with us again once again on a Sunday evening. And with this, I hand over. Amen. End this session and say Jai Hind, Jai Hind, sir.
Jai Hind.